The human body is an incredible thing, capable of some truly amazing feats and holding secrets that can shock even the most seasoned medical professionals. Today, we're going to delve into the world of medicine and share with you some of the most unbelievable cases that have left doctors completely speechless. Our first case involves a man who came into the hospital complaining of chest pain and shortness of breath. She was told it was migraines, anxiety, even hormonal changes. But everything changed when she suddenly collapsed. Scans revealed the truth. A 7-year-old boy who had always been healthy began limping one day out of nowhere. He hadn't fallen, hadn't been hurt. A young girl came to urgent care with what seemed like the flu, body aches, fatigue, and a slight fever. They almost sent her home, but her mother insisted on blood work. That decision saved her life. The girl had acute leukemia. 1 or 2 more days without treatment, and the outcome could have been tragic. But when doctors performed an X-ray, they discovered a sewing needle embedded deep in his leg muscle. At first, it was a few chuckles here and there, but soon he was laughing non-stop. From the bizarre to the terrifying, these cases have left doctors questioning the limits of human resilience and the mysteries of the human body. If you enjoyed this video, please like it and share it with your friends and family. And don't forget to subscribe for more content. But after surgery, doctors found dozens of metal objects in his stomach, nails, screws, even a key. It was later discovered that he had a psychological disorder known as pica, where people eat things that aren't food. But what shocked doctors most wasn't just the objects, it was how long they'd been in there, rusting, twisting, and pressing against his organs, not because something was funny, but because something was wrong. An MRI revealed a brain tumor pressing on his hypothalamus, causing a rare condition known as gelastic seizures. A patient came in complaining of hearing voices, not in their head, but literally from their own ear. It turned out to be a rare infestation. A live insect had crawled into their ear canal and nested near the eardrum. Doctors had to remove it while the patient stayed conscious, feeling every movement. The tumor wasn't there long enough for doctors to know how he'd managed to live so long without it being detected. But it goes to show that sometimes the most complex conditions can go unnoticed for years. The needle had likely been there since infancy, maybe even from crawling onto a needle that had pierced through without anyone noticing. It had gone completely undetected for years. A tapeworm had been living inside her brain, feeding off her for possibly years. But when her symptoms worsened, imaging showed she had a twin, a mass of undeveloped tissue with teeth and hair, called a teratoma, growing inside her. It had been there for decades. No one, not even her, had a clue. Imagine the shock on her doctors' faces when they discovered this parasite. Tapeworms are typically found in pork and beef, so it's unclear how this woman became infected. But once inside the body, these parasites can grow to enormous sizes and cause all sorts of health problems. Imaging suggested a tumor, but when surgeons opened him up, they found something no one expected. A small fir tree was growing inside his lung. Yes, a living tree. How did this happen? Well, somehow a seed had been inhaled and started sprouting inside his body. The moisture and darkness in his lung provided the perfect environment for the seed to grow, and the tree continued to grow until it was over a foot long. This is a rare phenomenon known as pulmonary sequestration, in which a part of the lung develops independently from its normal blood supply. The sequestered lung tissue can then become infected, leading to symptoms like chest pain and difficulty breathing. In another case, a woman had been suffering from severe headaches for years. Our next case will make you wonder how on earth it happened. Sometimes the scariest things are the ones we can't see. Some cases leave us scratching our heads. A man who had always been in good health started uncontrollably laughing. Our next case is both disturbing and fascinating. A man walked into the emergency room with intense abdominal pain and swelling. He hadn't eaten anything unusual. In Japan, a woman was treated for what was thought to be chronic acid reflux. And finally, we have a case that's sure to gross you out. These cases are just a small sampling of the many unbelievable stories that have unfolded in medical facilities around the world.